Hello everyone and welcome to oral surgery. Today we're going to be starting off by putting on some braces.
Welcome to Surgery Squad. I'm Dr. Jeff.
Hi, buddy.
And today we're going to talk about braces, those fantastic bands and wires that help straighten out crooked teeth. Let's face it, most of us do not have perfect teeth. Everyone's smile is unique. Some people's teeth are just a little more out of shape than others. Your teeth might be crooked, or your upper and lower jaws might not be the same size.
Sexy.
If your upper jaw is bigger than your lower jaw, that is called an overbite. If your lower jaw is bigger than your upper jaw, you have an underbite.
I have an overbite.
Sometimes your mouth is not large enough for all your teeth. That is referred to as overcrowding. In all of these cases, the problem can be fixed with braces. Braces are a series of brackets, wires, and bands that are used to guide your teeth back into the correct position. This improves looks, makes it easier to chew, and at times even improves speech. Our patient today has what looks to be an overbite.
You are always here.
How noticeable it is. We'll start by getting a record of the current state of her teeth in many ways, including x-rays, impressions, and photographs.
This poor woman, guys.
We'll start by taking some x-rays.
Okay, so this is the part where I had to take some x-rays. He didn't even say anything. He's like, we'll start with some x-rays, and then that was it. He didn't tell me what to do. He just made a little thing pop up on the screen. So yeah, so we're doing a what today? Did he say an overbite, perhaps? I actually have an overbite, as I just said. I'm not sure if you guys can see it very easily, but I do. I have an overbite, but I was lucky, okay, because my brother and sister had a ton of dental work when they were kids, like, in high school and stuff. My brother had braces until he graduated. Same thing with my sister, but I never had to have braces. I used to have a big gap in my teeth right here in the middle. I used to be able to fit like 3 or 4 pieces of paper through it. But as I got older and I started getting like my wisdom teeth and stuff, it pushed it together. So now I'm all good, okay? Besides for having kind of yellow teeth, my teeth are in pretty good shape. Yeah, okay. So what we need to do is we need to place that here. Okay, there you go, buddy. Click where indicated to place the X-ray cylinder. Dr. Jeff, you're really quiet today, man. I'm not feeling ya. Okay? I want you to be here. I want you to talk to me, okay? I really like your voice. I mean, I've had all those experiences with Dr. Susie and they just weren't the same. What are we doing here? There you go. I forgot how easy it is to do x-rays.
We'll take an impression of the teeth. We put a special gel on the bite mold. The gel comes in lots of terrific flavors, like candy cane and chocolate cake. Can you put the mold in the mouth?
I can. I will do that for you, buddy, now that you're telling me what to do, instead of just giving me little things on the screen. Here we go.
Great job. We'll have my assistant make the bottom impression. Once we have them both, we'll use the impressions to make a plaster model of the patient's teeth.
Okay.
Okay, we've got our impressions and x-rays, and we can see that our patient needs braces. I've also taken some photos for our before and after wall. We'll arrange an appointment for next week to put the braces in place.
All right, I'll see you then. 1 week later. It's such a weird music to play in this transition.
Our patient is back, and we're ready to put on her braces. In some cases, a patient may need spacers placed between the teeth for a week to create more room for the bands. Our patient does not. We'll start by polishing all the teeth. Making sure there is no debris on the teeth will ensure that the braces adhere better. Run the polisher over the teeth to clean them.
Sweet. We get to polish some teeth. Guys, I don't really like dental work all that much. I mean, the sound of that drill is kind of freaking me out, man. Am I even doing it right? Drag the polisher to clean the teeth. Click continue when done. I mean, I'm not really doing... Yes, I am. Yes, I am. Or am I? It's really hard to tell if anything's actually happening with these teeth. Nope, it's just making a lot of noise. I mean, just thinking about the drill grinding into my teeth is very unsettling. I know this is a polisher, but still, okay? It's just bringing back bad memories of dental work. Like I said, I didn't have a whole lot, but I did have some, because we all have dental work.
What a marvelous job.
Shut up.
I can almost see myself in those teeth. We need to put on some molar bands to anchor the braces. They circle the whole tooth and have a hook on the outside of the tooth. Slip the molar band over the tooth. We'll cement it into place later.
Okay, if you say so, Dr. Jeff. Here you go, a molar band. All right, I didn't know they did this. I mean, I don't know anything about braces because I haven't had them. I just know that my brother and sister had them, and they were always fiddling with stuff to try and clean their teeth. It looked awful, okay? If I ever get braces, they're going to be on the back of my teeth. Apparently, you can do that. You can get, like, braces on the back, and then you don't see them, and it looks a lot better, and yada yada.
Great. Now we can start putting the bonded brackets on the rest of the teeth.
Okay.
We've placed a lip guard over the teeth to give us room to work. Let's rinse off the teeth. Can you spray them with water? I run the suction to remove the water.
Okay, let's spray the teeth with some water. There you go. It doesn't actually do anything in this one. It's really weird, guys. They get you to do these things, but when you do them, nothing happens. Use the dental water pick to rinse the teeth. Click continue when done. I thought you were going to suck it out, buddy. You're not sucking. Suck more. Continue. Thank you, Dr. Jeff. It's about time.
Let's spray some air to get the teeth nice and dry. Can you handle that for me?
You just did the sucking. Why don't you just do the blowing while you're at it? Here you go. Yay. I'm doing such a great job. I am a fantastic helper. Done.
With the teeth dry, we'll now put a small amount of bonding agent on the teeth. Wipe a little bonder on each one.
Okay. So, now we actually get to do something, guys. Look at that. We get to actually put the bonding agent on the teeth, and it shows you when you've done each one. It's not just some random menial task that doesn't actually have any effect. Well, you can just click continue. I don't really want to have to do these all anyway. I would have just cut it, cut part of the video out, but here you go. I'm done. I did a great job.
Let the bonder dry for a minute or two so that it is sticky. Then we place a bonded bracket onto it.
Okay, so now we need to do the bracket. Oh, shit!
I will scrape off the excess bonding agent with a dental pick.
Sorry.
Now use a curing light to harden the bonding agent under the brackets. Click to turn on the curing light.
So much work to this surgery, guys. Here we go, and I clicked.
Great job.
Thank you.
Now I'll put the bonded brackets on the rest of the teeth. There we are. While I was at it, I readjusted the molar bands and cemented them. We're ready to place the arch wires. The arch wire is a thin wire that connects all of the teeth by going through each bracket. Let's slip the wire into the brackets of the bands on the molars. Move the wire to the mouth to put it in place.
All right, so now we have to put the wire between the teeth. Ah, like that. Is that it? Is that done now? That's the arch wire put on? I don't even understand how braces work, guys. Like, I have no idea. It's just like you put the things on and then you put the other things in between them and that's it. Right?
Good job.
Thank you.
We do not want the wires to poke our patient, so now that they are all snapped into place, I'll reduce the ends by clipping them off with pliers. And there we are. The arch wire is in place. Now we'll use elastic ligatures to make sure the arch wire does not fall out of the band. The ligatures are little rubber bands we snap over the front of the bonded bracket using a different pair of dental pliers. Now you try. Place the ligature over the brackets indicated.
You got it, buddy. Let's place a couple of those and then skip the rest. There's one. And two. Oh, so you twist them and then you put them on so they're in like an 8 shape. All right, well, let's just go all the way to half the front teeth, the top teeth, and then we'll be done. There.
And with the last ligature in place, our patient is done for today. In the next few days, she might experience some initial discomfort.
You look wonderful.
She should plan on eating soft foods and taking over-the-counter pain relievers if needed. Orthodontic wax can also relieve discomfort. If there is a real problem, she can always call the orthodontist.
Great.
It is important to take more time brushing and flossing when you have braces, as food can get lodged between the wires and the teeth. Our patient will have regular appointments about once a month for the next 6 months, and then space them out after that. The treatment usually takes about 1 year with braces, and then additional time with a retainer. The true length will vary by patient. She might also need additional equipment such as elastic bands, coil springs, or headgear. We will not know until we see how she responds to the braces. There you have it.
Thanks,
the
buddy.
braces are in place, and our patient is on the way to a beautiful straight smile. Thanks for coming by Surgery Squad. Why not check out one of our other procedures here on SurgerySquad.com?
Well, that was boring. I apologize. I expected that to be a bit more interesting, but it was actually extremely boring. Maybe it's just me. Maybe I'm just not into it today. But maybe giving someone a root canal will be a lot better. So let's give that a try. I don't think I've ever heard anything good about a root canal, guys. I'm pretty sure people always say really bad things about them. So, yeah, let's find out how it actually works. I know it has something to do with taking a root out, right? They take the root of the teeth out, and then you have no sensation in the tooth anymore, which is fine, man. Why do your teeth need to hurt anyway? Seems like a terrible
Surgery
thing.
Squad's virtual root canal procedure.
That's not you,
I'm
Dr.
the
Jeff.
one and only Dr. Jeff.
How can you be the one and only if you don't even sound like the other guy?
A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth.
You're an endodontic dental procedure.
During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection.
Okay, cool.
Would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Not really. But I'll do it, I guess. You guys want to see that? It's no good to ask you, of course, because you're not going to see the video until later. But okay, yeah. Let's look at some misconceptions, okay? Mike Tyson will be proud of that name. Let's do it.
I thought so.
Yeah, you thought so. What would you have said if I had said no? Would you have been like, oh, well, now my day's ruined, man, because I thought you wanted to know all about the misconceptions. Oh, no. Okay, well, read the myth, then click next to move forward, or skip and continue to root canal. Well, let's do it. During a root canal treatment, the tooth's roots are removed. Okay. I want to say that, well, it is a myth, right? They're not removed. There's still some roots down there.
Not even close.
Okay.
Remember, a root canal only involves cleaning, disinfecting, and sealing off the inside of the tooth.
Oh.
If the tooth's roots were removed, it would no longer have anything to anchor it to your jawbone.
Well, that's not what I thought of when I thought of roots. I thought the roots were like the nerve roots or whatever. Okay, that's cool. Moving on. If a tooth doesn't hurt, it doesn't need a root canal treatment. That is false, because sometimes you don't feel things that suck, okay? You could have a really bad disease and not know it, okay? That's why they do tests on you.
Not
Jeez.
true at all. It is very possible for a
Cool.
patient...
Pulling a tooth is a better option than having a root canal. That's false. Nobody wants to get their tooth pulled, okay? Because if you get your tooth pulled, then you don't have a tooth anymore. Duh.
Often patients may choose to have a tooth removed instead of having a root canal. While this may immediately seem like a simpler and more economical choice, it's often the opposite.
Cool. All right, teeth that go through root canal treatment are eventually lost or pulled. That's false, man, because once you do that, you're all good, right?
Not exactly.
Yeah,
With
exactly.
positive
Goodbye.
oral-
Root canal treatment requires multiple appointments to complete. That's false, obviously, because they're all false, but still, you can do it in one appointment.
There is some truth to this statement.
Okay, whatever.
The number of appointments that are required to complete your root canal treatment depends on a few variables. These include how your dentist has been trained, their experience, equipment available to them, and the condition of your tooth.
Okay. Click next to begin the surgery. Yeah.
Let's move
Those were
on.
great.
In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line.
Yep.
But first, apply a topical numbing gel to the injection site.
Nothing is
This
more
will
comfortable
help
than getting an
reduce any
injection.
discomfort the needle may cause.
There you go.
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours.
All right.
Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
I was thinking of doing it on the opposite side, because that sounded like a great idea. Here you go. Pop that in there. Wow, that was a lot of stuff to put in there.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
5 minutes later.
Now that the patient's mouth is numb, we can move on to isolating the tooth.
Okay.
Since our patient's saliva contains contaminants that we don't want getting into the tooth,
Suck it out.
isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth.
Okay. Okay, cool. So your saliva is not good for the inside of your teeth. That makes a lot of sense. Click where indicated to place the dental dam.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe.
I said that. I said we were going to need to do that. Okay, we're going to have to suck stuff out. But in this case, we're... I don't know what an air water syringe... Oh, is that the thing you blow on it with? Or shoot water at it with? Yeah. There you go.
So far, so good.
Yeah.
Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Let's do it. Let's make an access cavity. I'm going to access your cavities, buddy, and there's nothing you can do about it. Oh, yeah. Oh. I hate the sound of that, man. I hate the sound of dentist
step
stuff.
is to clean and shape the tooth's canal using a root canal file. go ahead and give it a shot.
The thing that scares me most about surgery or like oral procedures, guys, is the fact that they do stuff to you, and then like you don't know if it's completely numb. You don't know if they're gonna get in there and start jamming it in and it's gonna hurt. And it happens to people all the time. Like they'll be like, "Hey, does it hurt?" And they're like, "Yeah, it fucking hurts. Can you not?" Like that's not good. I don't like it. Click where indicated to clean and shape the tooth canal. Okay, so just jab that in there, I guess. Wow, good job.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Just throw some bleach in his mouth. That sounds like a good idea too. Irrigate the tooth's canal using bleach. I like how it's just the sound of someone pouring up a drink.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
How do we get it out again? Oh, it's 5 minutes later. There's no music this time.
Great. Now use the suction to remove the bleach from the patient's tooth.
Ah, that's what I thought. We gotta suck it out. I thought we were just gonna like, just jam something in there and push it out, and then he'd get bleach all in his mouth and he'd die. Next time. How are we gonna get it all the way down to okay?
Next, we'll need to fill the tooth using a rubber compound known as gutta percha.
Gutta percha?
Gutta percha is often preformed as tiny, thin cones
Gutta
that
percha.
we'll insert into the clean canal of the tooth.
It's a great name.
I've already added some sealant to the gutta percha cone. Let's see what you can do.
I don't know what I could do, man. I'm gonna try. Okay, gutta percha away.
Looking good.
Is it?
A heated instrument is now used to remove the excess gutta percha.
Stop saying gutta percha, man. It's such a stupid name. Click the gutta percha cone to remove the excess. There.
Pack the gutta percha into the tooth canal using a plugger.
Okay, I'm ready to pack the gutta percha. Okay, so it's some sort of like putty or something? I wasn't paying attention to what he said.
Has been placed. It is common that additional x-rays are taken to verify that the canal has been adequately sealed off.
Okay.
Once the dentist verifies that the canal has been sealed, a filling
Crown.
or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures.
Nice self-promo, Dr. Jeff.
SurgerySquad.com.
Who's it going to be this time, you or the other guy?
After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries here on SurgerySquad.com.
Well, Dr. Jeff, that was just a fantastic experience, and I'm so glad that I had it with you. But I still want to know, like, which Dr. Jeff is the real Dr. Jeff, man? I'm getting kind of worried. Like, I don't know, like, at one point, it was just the one Dr. Jeff, right? It was the Dr. Jeff with the turkey and whatever the hell else he did. And then Dr. Jeff sounded different. And now I'm wondering, was Dr. Jeff different all along? And did I hear the real Dr. Jeff after that? Or was the real Dr. Jeff replaced with this new Dr. Jeff who I don't like? Maybe I do like him. I don't even know anymore. I'm going through some sort of existential crisis for Dr. Jeff. Anyway, guys, I'm going to end this video here, so thank you so much for watching. If you enjoyed this video, don't forget to leave a like, and I will see you next time. Goodbye.